Welcome to our class, our antenatal class, Meeting Your Baby. My name's Sandra Flanagan and I'm a community midwife from Poole.
Hello, my name's Sarah Bird. I'm one of the midwives from Bournemouth. We're working together at the moment, obviously, with the virus, and we'll continue to do so in time. I work in the birth centre and in the community.
Hi, I'm Karen. I'm maternity support at Poole Maternity. I will be seeing you at home when you go home with your babies. So hopefully we're going to talk about lots of things today, and you will find them all very interesting.
So today we're going to cover skin to skin, golden hour, vitamin K options for your baby, the initial baby check and also the body changes to mum and baby changes. Then the NIPE, which is the neonatal examination, and then Karen's going to talk to you about getting to know your baby. So, baby born, the most beautiful thing that you've ever seen. So, the hard work has been done, and your baby's here. So, I've got a baby. Let's have a look, see if there's a baby.
Find you a baby.
I'm going to have a baby. Here we go. Here's my baby. So, now the best thing now is skin to skin, which is really important for your baby. It keeps baby warm. This baby's got an outfit on, but we say skin to skin. It keeps baby warm because mum acts as a radiator, which helps to regulate your baby's temperature. It also calms baby's heartbeat. Your baby's been through a long journey and it recognises the heartbeat from when it was in the womb. So it's very comforting. Also reduces mum and baby's stress, and baby's, like I say, it's been on a long journey, so it needs that comfort. Regulates baby's breathing and also promotes the breastfeeding if you are going to breastfeed your baby. So, and we also recommend skin to skin for partners as well, so which is really great for bonding. Now, the golden hour, that's the first 60 minutes following birth, and that's why it's known as the golden hour, and it's really important for skin to skin and baby bonding, and it really helps to promote successful breastfeeding. We will help you to support, or we will support you to keep your baby skin to skin for that hour, or at least until the first feed. Okay. The initial baby check. So when you've had that skin to skin and you're happy for us to just to sort of take your baby to one side, we will look at it thoroughly. We'll do like a head to toe check. Okay, we'll look in baby's mouth with your consent as well, just to sort of check for any abnormalities. We will check your baby's head circumference, so we'll give your baby a hat size, and we'll also take your baby's temperature as well. Okay, now we then we'll weigh your baby. So this is done in kilograms, and we can convert it accurately, 2 pounds and ounces, using the red book that you've been given by the health visitor. It's got a really accurate conversion in the back of that book, so that's what we use to convert kilograms to pounds and ounces. Vitamin K. So this is recommended for all babies. Like, every baby is born with low levels of vitamin K because it doesn't perfuse very well through the womb to your baby. From mum. And we all need vitamin K to help us clot our blood. And your baby will make its own vitamin K as it matures. But in those first few hours, your baby is deficient of vitamin K, and we offer a vitamin K supplement. Now, this can be either done by injection or by oral drops, so you do have the choice and you will be asked at the time. The injection is a one-off injection just into your baby's thigh with your consent. And if you prefer your baby to have the oral drops, then we can do that in 3 doses. Now, we do the first dose when your baby's delivered on day 0. We then send you home with the 2 other doses. So that will be between day 4 and day 7, and then a 3rd dose at day 28. So you have to be pretty organised to remember to do those doses, but you do have the choice. So I'm passing over now to Sarah.
Passing the baby. Okay, so I'm Sarah, like I said before. I'm going to tell you a little bit more about the first 24 hours. There we go, there's the list. So the question really is, where did normality go? So I'm going to be looking at body changes for mum. So we'll go through those. I'll do each one as we go down the list. And also I'm going to be looking at some of the things that baby will be doing as well. We'll go to that in a moment. Okay, so in the first 24 hours is what I'm looking at. So you may be at home, especially if baby's been born and everything's been normal. We're happy with the way baby's feeding. And there's no concerns with you or the baby. The doctors don't want to keep baby in for any reason, or yourself. Otherwise, you may well be on postnatal ward. If there are some concerns or they want to keep an eye on baby, then that's where you'll go with the baby. With lockdown, it is no visiting and no partners at the moment. That could change as time goes on. But for now, it's mum and babe up on the postnatal ward. And then when it's time for you to go home, then dads will pick you up from the front door. It's a good idea to have a mobile phone with you, because that's the best way of keeping in contact, and perhaps you can do some video calls and things from the ward. If you have been sent home because everything's gone well, again, you'll be in the labour room together, and then both of you go home in the car with baby. Well, I say both, there's 3 of you now, which is what I'm talking to about, is where did normality go? Because things definitely have changed. So what I want you to talk about really is the changes that happen in your body, first of all. So it's taken you about 9 months to get this baby born and growing in your tummy. So it's a bit, if you think about it, it's a bit optimistic to expect your body to be absolutely normal, back to what you think is what was normal once the baby's born. So there'll be a few changes that you'll need to deal with in the first 24 hours. What I'm hoping to do is prepare you with some knowledge and some remedies to help you through that time, knowing what's normal and perhaps what's not normal. So it's a top to toe check, or I'm going through top to toe from the top of your body down to the bottom, what to expect in the changes. And as I say, it's a very quick check through the list, because can't deal with everything. Not everyone's going to have everything. So I'm going to give you a few suggestions. And then if you need any more information, there's useful tips at the end of this session you can have a look at on the website. So the first thing I'm going to talk about is sore nipples. This session on breastfeeding would have been done, I think it's session 5. So they would have gone through quite a lot about breastfeeding, but it is really common to have sore nipples. Don't forget, you've never used your nipples in quite the same way before. And so they are going to be tender no matter what position. If the position is good, if the baby feeds well, you're still going to have slightly tender nipples. So it is normal. What we're hoping is that in the first day or 2 you'll get that, but as the feed progresses, so the nipples should actually improve and not feel worse as the feed goes on. If that is the case and your nipples are starting to feel worse as the feed goes on, please talk to a midwife, because we will try and help you with adjustment of position and some other things to help with that. There are nipple creams available on the market. You need the ones that you don't need to wash off, so the ones that you can put on before a feed or after a feed, and you don't need to wash it off. It's not going to affect the baby. The other thing you can use is breast milk. So squeeze a bit of breast milk out and rub that around your nipple before, again, and after the feed, because that actually, breast milk's a very good healer, so that might help you as well. And the other thing is exposing to air and light. I'm going to talk about air and light a lot. It's a really, really natural resource. We've all got it, and it's absolutely amazing for healing many things. So as we go through, I'll sort of put that in place where it fits. The other thing is, even if you don't breastfeed, or if you've started breastfeeding and you decide to stop, the other thing is your nipples or your breast can fill up and become quite full, quite hard, quite tender and very warm. But something to help that would be Savoy cabbage. So get yourself a Savoy cabbage if you can, stick it in your fridge, and then pop the leaves into your bra. It sounds really daft, and I'm really not a hippie mum, but I maybe have tendencies towards that, but actually Savoy cabbage is a really known remedy, and it will take the heat and some of the tenderness out of your breast. So it's definitely worth remembering that. So moving on, the next thing, let me just get that slide up so you can just see again what we're talking about. If I can get it. There we go. So we're looking at next blood loss and after pains. Then we'll look at jelly belly, save me going backwards and forwards between the slides, stitches and hemorrhoids, and swollen ankle. So in the first 24 hours, a heavy blood loss is very normal. We expect, sorry, I'm going to go back to the one I'm doing. We're getting a bit of a problem here, but it's fine. There we go, we've done it. Back again. That's it, take it off, that's it, there we are. Oh, that's fine. So in the first 24 hours it's really normal to have very heavy blood loss. Don't forget you've laid down quite a thick lining for your baby to grow in your abdomen, in your uterus, and so that is not needed anymore, and you're going to be losing that. As I say, in the first 24 hours I'd expect it to be heavier than you've ever had before. After that sort of day, I'm just thinking sort of day 24 hours to 3 or 4 days, it will change quite dramatically. So red and heavy in the first 24 hours, you'll need to change your pad probably every hour to 2 hours, and that's normal. By day 1, 2, 24 hours plus, I expect it to become a lot less, go a little bit more pinky and watery loss, and for you to change your pad really sort of starting to be every 3 hours or so, and eventually just more for comfort than anything else. So that's what we're expecting. So if you find that you are suddenly bleeding more heavily again on, say, day 3 or 4, and you're changing your pad really quite frequently, we need to know about that. So please contact your midwife, because it's important that we catch anything that's not quite normal there. You will find, though, over the first sort of day or two, when you start moving around more, when you've been up and down the stairs, or something you haven't done before, like gone for a walk or something, you will find your blood loss is a bit heavier. And also after a really satisfying breastfeed, because the hormones of the letdown from milk also contracts your uterus, and that's what's happening, is your uterus is contracting to get the blood out, but also to get itself back to its normal shape, and that happens more quickly when you're a breastfeeding mum. What I was going to say is that, yeah, the unusual thing is the gushes. At least if you're changing your pad every 30 minutes, we need to know about that, especially from day sort of 2 onwards, really. The other thing I was going to talk to you about was after pains. It's not something that first-time mums are necessarily aware of. It's much more for second time and subsequent, because your uterus has been stretched before, so it's got a little bit further to go. So it hurts as if you've got period pains, or some people describe it as contractions as well. That can happen with the breastfeeding. It is quite normal, as I said, because it's your uterus returning back to its normal shape, and that can take a few days up to weeks actually to actually get right back. But it's only in the first few days that you'll have the after pains. Do get some paracetamol and some ibuprofen, which are the drugs of choice that we would recommend, and that will just help you. Take it regularly as it says on the packet. Let's have a look, what else do we need to do? Then the other thing to help with the after pains is a bath, a deep warm bath, not for hygiene necessarily, more to actually relax your muscles and just aid with some of that pain. Don't put any bubble bath in it, because if you've got stitches, you're going to need to protect them a little bit. So just plain water, nice and deep, nice and warm, and use it as a way of relaxing those muscles, because you've just gone through pretty much a marathon, and it would be good to ease the muscle aches as well. Right, moving on, jelly belly and muscles and posture. So jelly belly, as I said, it's your expectation to go back to normal following the birth of a baby is quite high. That is a high expectation, and it's not, I wouldn't expect that to happen. My experience from my first baby, I just remember when I first stood up, the pressure of having the muscles that had been pulled out and held out by the baby against my chest was I was aware of it, and it felt odd that I had pressure against my chest, just below sort of my ribs. But if you think about it, it's where the muscles have been stretched by the baby, and as the baby's no longer there, they are going to sort of put a bit more pressure against you there. So when you stand, you'll feel a drag and it will feel heavy, but it's usually only in the first couple of times you stand up, and then that should settle down. And then as you move around, you will notice the change in your body. Your tummy will not be flat. Just because there's no baby holding that tummy out doesn't mean to say it's going to go flat. It's going to be stretched. The muscles are stretched. You've got stretch marks as well. All of that is really normal. And it will go back to normal, but you do have to give it time. So it takes a couple of months really to get everything back to normal, or at least the normal that you're going to be ending up with. So standing up straight, first of all, after having a baby, can be quite difficult. And one of the things I found was if you put your back against the wall, so stand up against the wall and push your shoulders back, so you're actually lifting your posture a little bit, and then as you've done that, you then push the small of your back into the wall. So you're doing like pelvic tilts against the wall, pushing your back and shoulders back. That will actually help to strengthen those muscles back up again, to lift your posture up. It will actually help with wind, if there's any wind trapped as well. And you'll soon find that you can stand straight without any trouble at all. Right, moving on. But one other thing, I'm said here, be kind to yourself. Don't expect it to happen straight away. You've just accomplished the most awesome thing, and you need to enjoy the time that you've got, and don't put pressure on yourself. Just be kind to yourself. Okay, moving on. My next thing is stitches and hemorrhoids. The things I've got to talk to you about are really horrible, but at least you know it's normal. So stitches and hemorrhoids. Stitches are most likely to happen with first-time mums, not quite so much with second and subsequent. They are dissolvable. Try not to be scared of them. It's something that's really quite good. It's helping your body to heal, and it will hold the muscles. What they're basically doing is holding the muscles together so your body can heal itself from the bottom up. So it takes a bit of time because the skin is coming together and it's healing from the, as I say, from the bottom up. So it's just holding your skin together, and your body will do the healing. So it's good to have the pain relief again. That's the paracetamol and the ibuprofen. It's really good to think about hygiene. So shower at first in the first couple of days, and then again go for that bath. Again, not for too long, 30 minutes, so that you don't soak the stitches too much, but a nice deep warm bath will make such a difference. And once you've had that bath, pad yourself down so you're not wiping anything. Any of the new tissue needs to be kept in place, so pad it down gently. And then if you can expose it once again to air and light. Air and light, as I said, is an amazing healer. It kills bacteria, and it encourages that your body to actually heal itself, which is really good. Suggest that you don't put any ointments or creams on that area at all. Right, moving on, hemorrhoids. So I know I said that the stitches are more first-time mums. Second time and subsequent are much more likely to get hemorrhoids because it's a weakening in the muscles of the rectum. And that's what happens in conjunction with more blood in your system and the pressure of the baby. So what you need to do is to encourage your do your pelvic floor exercises to build up and get those muscles really quite tight, because that will really help afterwards. There is after the baby's born, we'll give you a booklet with the exercises in it, but you can actually Google postnatal pelvic floor exercises, and there's lots of information about that. For hemorrhoids, there is Anusol available, whether you want to wait and see if you have them before you get some in the house. And they can actually often be more painful than the stitches. Women that I've looked after have said that they didn't even notice the stitches, but they did notice the hemorrhoids. What you need to do is reduce them with the Anusol, and then in the bath, once they have reduced a little bit, try and pop them back in and do your pelvic floor exercises again, because that tightens up. What's happened is that the muscles of the rectum have relaxed a little bit. The pressure on all your blood vessels is great when the baby's coming through, and it pushes the little blood vessels through the rectum outside the body when they should be inside. So all you want to do is get them back inside, really, and then you will notice that actually the pain goes away and you're not aware of them anymore. It's often a long second stage that can cause them. It's the weakness in the pelvic floor, like I said. It's the increased blood flow in your body, which everybody has, and it just takes a few days for that to go away. What it will do, though, it will increase your anxiety about having a poo. Actually, stitches and hemorrhoids, you often ask me, or the women I look after often ask me, well, I'm going to do a poo, but I really don't want to do this because it's going to make it worse. The best advice really is to don't put it off. If you have the feeling to go, you need to go. Eat the food and drink that you know is going to help you keep your stools nice and soft. So lots of water. I always go for dark chocolate because that really works, and I like dark chocolate. But a bit of coffee, espresso coffee if you've got access to it. Fruits and vegetables, obviously, lots of fruit and vegetables are really good for you. Lots of water. The other thing is, when you do a poo, put a clean pad on your stitches, so at the front, and then you're putting a bit of counter pressure, so that will relieve the anxiety a little bit, knowing you're not doing any harm. And the other thing is to get yourself into a position where it's more suitable or more productive, is what I've written down here, a more productive position for a poo, which is basically lifting your knees. You need to elevate your knees so that you're in a little bit more of a squatting position. That reduces the muscle tone and allows the poo to come out better. There's actually some interesting things on the internet and things to buy. If you wanted to have a look, it's like a step that you can get. But actually, rather than buying the step to do that, you can actually use a child step up step that they use to get to the sink. So that works just as well. So the idea is to elevate your knees because it makes it easier. Right, enough about poo. Let's move on. So now swollen feet and ankles is the next thing. So we're working our way down the body. So it is very natural, very normal for you to actually develop swollen feet after the baby is born and not actually have them at all before, because what happens is the baby's born, your body is now returning to normal, and you have more blood in your system, more fluid in your system than you actually need. And so what happens is your body sinks it down to your feet. It doesn't bring it back up to your heart very well, and your kidneys need to be able to get rid of it, but it's storing it down there till they can. So what you need to do is elevate your feet as much as you can. And this weather, probably put them in cold water, which you're probably doing already being pregnant. Kidneys are working overtime. So actually, it sounds daft, but if you drink more fluid, your kidneys are encouraged to work even better and they will clear it better. The other thing is that when you elevate your ankles, it's ankle circle and deep breathe, and that will bring the blood back to the heart as well. And that's back to the kidneys too, and they can work better. What else was I going to say? Oh, yes. What your body is doing with this fluid is that the kidneys are clearing it all out and making your blood making sure your blood is going back to normal. So you get a bit of sticky blood, which we need to keep an eye on your calves for, because the fluid from your blood is going out. So you're going to need to wee a lot more. So your bladder will be quite full. You'll find that you're doing some really satisfying wees in the first few days. What you do need to do is maybe set an alarm at first, because the triggers to wee can be disturbed by labour. So you might find you have a really full bladder and didn't even know it. So if you can set an alarm and wee every couple of hours in the first 2 days, that really helps to keep the bladder empty. And we don't want your bladder overfull if you can help it. And then what else was I going to say? I think I might have dealt with that. Yeah, deep breathe, ankle circle, that's good, and drink plenty. So those actually are a few things that you might notice, but there are many, many more things that can happen to your body and changes. If you're not sure, you can always speak to your midwife, but there is quite a lot of helpful hints and things at the end of the session on the internet. Right, moving on now to this little one, who's not actually so little. Yours won't be this big when it's born, just to warn you. Let me just get the thing up so you can see what we're going to talk about next. Is it? It's that there, yeah? No. Oh, what have I done? Hang on a second. Sorry,
So that's not it, is it already?
That's it. So now I'm doing baby care. So we're looking at baby now. The NIPE, which is something I do, or a number of midwives will do in the first 12 to 22 to 72 hours. A little bit more about feeding, but not so much. Winding, nappy changes, and jaundice. So that's what I'm going to be looking at. So let me talk to you a little bit about the NIPE. Thank you. Me again. Okay, so the NIPE stands for the Neonatal Initial Pediatric Examination. So basically what it is, it's a full top to toe check of your baby, just making sure that everything is in place. We've done the initial one, that was when the baby was first born, but this is a little bit more thorough. So we're looking in baby's eyes, we're listening to baby's heart, checking muscle tone, checking skin, making sure everything is intact. We're also looking at baby's hips. If you've got a baby boy, we'll make sure that his testes have descended. We're also looking just to make sure that everything is where it's meant to be, and we've got some good reflexes. So babies are born with 3 different types of reflex, or probably more than that actually, but ones that we check, and we'll talk you through that when we do the session. It is, as I say, between when your baby's up to 12 to 72 hours. When I do the baby check, I undo the baby completely. Looking in baby's eyes is interesting because they don't always open it when you want to. So I call it an opportunistic test. So whenever that baby opens its mouth, I'll grab the mouth. If it opens its eyes, I'll grab the eyes, but I'll carry on going through. Part of the test is to turn baby over and to check baby's spine. So that's quite important to do that, make sure it's well formed. But at that point, baby is naked. I put the nappy underneath, and baby's lying in the cot, or sometimes on mummy, while I check everything over. And this is a good thing to do every day with your baby. Actually, it's called tummy time. It's something you'll do while you're awake and watching your baby. Never put them on their tummies when they're sleeping and when you're sleeping, because it's not a recommended position, but it is good to do for about 10 minutes every day. What we're trying to do is build the muscles of the baby's chest, because we found that since we've started lying them on their backs, they're not so good. They don't have such good muscle tone in their chest anymore, and they're obviously going to need that for crawling. So it's good to do it every day, just for 10 minutes or so. Make sure baby's happy and comfortable. A naked baby if you want to, doesn't have to be, but it's a really good time to bond with your baby too. So a bit of baby massage, a bit of air and light to that bottom again. I love air and light. So nappy off, clean bottom obviously, and then let that air and light get to the nappy area, because they got the nappy on all the time, so it's really nice for that skin to have a bit of a break from it. And it also gives you time to get to know your baby. It's actually good on the baby's tummy as well, because they can often bring up wind that they're struggling to bring up when they're lying in this position. So it's a really good thing to remember if you can do that just once a day for 10 minutes at first, and that changes as time goes on, sort of make it a bit longer, or as you get to know your baby, you'll know what baby likes. So what else was I going to say? Yeah, it's a good bonding time. So the nappy is something we offer to every baby, and we're just checking, as I say, if there's any family history of anything like heart conditions or hip conditions, we'll ask you about those details at the time. So on to feeding very briefly, because again, it's been done in session 5, but I just really wanted you to know that a baby can be very sleepy when it's first born. So we have that initial golden hour that Sandra was talking about. So you've got the golden hour, and they will be alert and wanting to feed. Try and use that time to get as much milk into that baby as possible. As far as breastfeeding is concerned, if you're bottle feeding, it needs to be little amounts at first, because their tummies are very tiny. If you're breastfeeding, we're trying to encourage it, so the more often you can put them on, the better in that time. Then you'll probably find that baby is quite sleepy. If you've had a cesarean section, the baby's got quite a bit of mucus in its body, and that will actually make it think it's full. So actually after about 4 to 6 hours, once you've had a nice long sleep, hopefully you probably won't because of your adrenaline, but baby will. If you can then start to think about waking baby up about 6 hours after you've had that first feed, if it's slept for that long, you do need to start taking a hand. And after that, you really need to feed the baby every 2 to 3 hours, even if you're bottle feeding. Don't leave longer than 4 hours if you can help it at first, because this is a very new baby and it just needs to be reminded that it's in this world, and you need to keep it aware of being awake really and alive. And so the more you wake it up and feed it, the more often, so 2 to 3 hours, the better. Babies that go 5 to 6 hours, it really isn't safe and it's not right for them in the first few days. Winding, I'm naturally doing it actually. Let me just show you. So with these babies, there's a number of different ways to wind them. You will be told that breastfed babies don't need winding. Some people will tell you that. They probably do still need winding, not as much as bottle fed, but it's a really good thing to do. It's a good practice to have. So learning to actually how to wind your baby. So some people like to sit baby on their lap, pop baby's chin on their hand, and you can wind like that. I find if you use your hand and pat, if you put the palm of your hand on their back and you pat with your fingers, you can't hit the baby too hard. You're not patting too hard. That will release and loosen the wind and it'll help bring it up. Or pop baby, what I find is the most effective, is putting baby up over your shoulder, obviously guarding the head and making sure the head is nice and safe. And again, you can pat on the baby's back like that. So those two things. The other thing is if you change baby's position, so don't be there for like half an hour waiting for this wind to come up, because that's a waste of time. If you lie baby back down again and lift baby back up, those is the more the moving rather than just keeping in one place. It's more the action of moving that actually helps the wind to shift. Sometimes you'll find you've winded that baby and then you lie it down again, and then half an hour later, sorry, that baby, it's your baby. Lie the baby down, you might find within half an hour that baby's woken up again, your baby's woken up again. So what you might need to do is lift it and try winding again, because sometimes it collects in the tummy, and as you lift the baby up, you'll get a bit more wind. But if baby carries on being upset, offer it food. It's always good to offer food, especially again if it's breastfed, because these breastfed babies, you can't see how much is going in, and sometimes they'll have a little sip and sometimes they'll have a full feed, and you won't know the difference at first. And finally, I think I've got, oh no, not quite, jaundice. So jaundice is something that doesn't happen to every baby, but physiological jaundice is something we often expect, especially with breastfed babies. What happens is you've got an immature liver, and the baby is breaking down a number of blood cells in its body that it no longer needs. And so the immature liver and the excess of broken down blood leads to something called bilirubin, which is a yellow substance, and that sits underneath the skin until the liver can deal with it. So baby will look as if it's suntanned. So long as that doesn't go to orange or bright yellow, we're happy. So long as also you're doing things to help, which is feeding the baby regularly, lying in light, again, sorry, I'm fixated on sunlight, I think, and just keeping an eye on making sure it's waking and it's feeding and it's alert. If we have a sleepy baby who's not feeding, then it's not getting enough milk, and then the cycle means that the liver doesn't have enough milk to bind the bilirubin to, so that builds up and makes it more sleepy, and we have a cycle going on where the baby is getting more and more jaundiced. We need to know about that. It's really important. But if you feel that the jaundice has come after day 1 to day 3 and it settles down by day 14, if by day 1 to 3 you're starting to get baby a bit yellow, you can let us know, let the midwives know, but it's not something we're too worried about so long as baby's feeding well as well. Last thing I've got is nappy changes. We've got a beautiful picture coming up showing you all the different poos that there might be. In the first few days it's black and sticky. Oh, that's it, lovely. We'll give you the picture while I talk about it. So in the first few days it's sort of black and sticky like tar, the day 1. Day 2, we're expecting it to go a little bit darker green, sometimes a bit mucousy. Day 3, obviously. Day 3, 4 and 5 can actually be bright yellow straight away, or it can take a couple of days for it to come through to bright yellow. So it can be bright yellow from day 3 if baby's feeding really well. The consistency for day 1 is like tar. It doesn't smell at all, which is fantastic, but it does get everywhere, and you won't know because they haven't made noise and it doesn't smell, so you do need to keep checking that nappy. It does quickly change from the sticky tar to much more easy to wipe off, and then when it's runny, it's yellow runny, it's got little white seeds in it. That's all really, really normal. I have had phone calls from mum saying my baby's got diarrhea, I'm really worried. So, well, how are you feeding? I'm breastfeeding. Well, we expect the baby to have what we would consider diarrhea. That is a normal stool for a baby to have because their tummies are immature and they're using up what they need, and they give you the waste, which comes out as really runny, really wet, bright yellow poo. You'll never eat chicken korma in quite the same way again. But I would say that any concerns, obviously, that you have, please speak to us. The yellow stools are really easy to clean, but they do come out with force, and that yellow is actually, it does stain light cloth, so be careful where you point that bottom. So a lot of what I've told you, you will realise is normal anyway, because you're quite sensible and you're tuned into your bodies. And as the baby grows and as the baby changes, you will become the best people to look after your baby. So I am now going to give you over to Karen, and she's going to tell you a little bit more about your lovely baby.
Hello, guys. Right.
Karen, do you want your baby? I'm
Oh,
passing
yeah,
the baton, passing the baby.
Oh, I've got my baby. I'm happy. Okay, now I am aware, guys, that we do cover an awful lot of stuff in these sessions. We don't expect you to remember everything. I want you to realise that when you do go home with babies, there's always going to be someone that comes out to see you, or there will be someone at the end of the phone. Okay, so don't worry too much. We don't expect you to remember everything that we're going to talk about today. So hopefully you can see me or a slide. I just want to talk about roughly what we're going to, I probably won't stick to this slide. I probably will waffle on about everything else, but anyway, there we are. Okay, so we've got, now we are 3, getting to know your baby and what to expect. So we're going to talk about baby's behaviour, circadian rhythms and sleep, which is my favourite topic of all time. We're going to be talking about temperature of baby and environment, baby skin, some cord care, and a little bit about baby's eyes as well. So beginning with temperature. So I'm not sticking to the list. I'm going to talk about temperature. In our climate, our temperature can be, as you are aware, very up and down, and it can be difficult to know what to dress baby in. So we would suggest you dress according to the environment. When baby's first born, the midwives are really anxious about the baby's temperature and making sure the baby is able to maintain its core body temperature. When you go home, they'll be putting a hat on the baby and they'll be wrapping the baby up and putting the baby on mum's chest to try and keep baby warm. When you go home, you do not need to worry quite so much, okay? When you're indoors at this time of year, you will not need to be putting a hat on the baby. In fact, with regards to temperature, less is more. It's better for your baby to be slightly cooler rather than too hot. Now, I'm hoping you can see me. If you want to check your baby's temperature, we would suggest you get a couple of fingers and either feel just on the front of the baby's chest or just on the back of the baby's, on the baby's back. Okay, so the baby should feel nice and warm. Hands and feet will often feel cold and even can look quite blue, and that is nothing to worry about. It's because all the blood supply is focused on the baby's most important systems. Okay, so you've got the heart, the brain, the heart, the liver, the lungs. So extremities like hands and feet will feel cold and look quite blue. So please don't worry. All right, it's going to bother you more than it bothers your baby. Optimum room temperature, surprisingly, is about 16 to 20 degrees, which can be quite cool. Your baby is only going to need one more layer than you. So if you're wandering around in next to nothing, just don't be wrapping your baby up too much. The problem is if babies are really warm, an instinct, I think, to, oh, we must wrap baby up, and grannies are the worst. You've got to wrap your baby up. If we wrap our babies up too much, they're going to be quite sleepy and they're not going to be waking regularly for feeds. All right, so it's really important to be slightly cooler rather than too warm. So that's temperature. With skin to skin, with skin, baby skin can become quite dry and flaky in the early days, about the first week after birth, and that's quite normal. Sometimes babies can develop little cracks in their wrists and in their ankles, and the skin can be really flaky. We don't suggest doing anything to that because it is a natural process. Your babies come from a very wet environment in the womb into a very dry, abrasive environment. So all the time that we're handling our babies and we're undressing them, that's all friction on their skin, which is really delicate. So it's quite normal that they can become quite dry and flaky. The best form of skincare is skin to skin, and there is never too late to do skin to skin. All right, so we literally mean strip your baby right down to the nappy and get the baby on your naked chest. Okay, we've got good bacteria on our skin and that will rub off and that will colonize onto your baby and protect your baby. All right, with skin to skin, it helps regulate the baby's temperature. It regulates the baby's breathing. There's a really interesting piece of research done on something called limbic regulation. And what that is as the mother breathes out carbon dioxide, that stimulates the baby's nasal and to breathe in. So it's as you breathe out carbon dioxide, that stimulates your baby to breathe in, and that's how we're regulating their breathing. So we're regulating temperature, breathing, and their heart rate as well, or helps keep them calm. Cord care. Now, with a baby, when they're born, the cord is cut. I don't have a cord on my baby, so it's a rubbish baby, really. But babies, when they're born, they're left with a small stump of the umbilical cord, and that will have a clip on it. Now, what we would suggest you do is absolutely nothing. Again, as Sarah spoke about earlier on, lots of air. So keep the nappy folded down, let the air get to the cord, and what will happen is it will just dry up and it will eventually fall off. Now, this can take anything from a couple of days to up to a couple of weeks. Sometimes the cord gets knocked and it can bleed, which is fine. If you want to clean it, we would suggest just using some either express breast milk, which is amazing for anything, or just some warm water, and just gently clean it around the outside. And again, let the air get to it and let it finish drying up. If you're ever worried, you just ring somebody. You can take a picture and send it to a midwife or a support worker. Okay, so don't be too worried about it. It is actually a process of gangrene, so sometimes it can be quite smelly. You think baby's done a poo. When you look, the nappy's clean. It's likely to be the cord. Just let the air get to it. Let it finish drying off. All right. As the cord actually separates, underneath at the base can sometimes look a bit greeny or a bit yellow, a bit moist. That is normal. It's just the skin healing and repairing itself. But if you're not sure, if you're worried, you just ring somebody. Okay. Eyes. So very briefly about eyes. Eyes can sometimes be a little bit sticky. Babies don't produce tears in the early days, and they get a little bit of sleepy dust. And again, it's just gentle cleaning with, it's important to use cooled boiled water for eyes because that's sterile. You'd get a cotton wool ball, you'd moisten it, you wipe from the inside and then you wipe away. You throw that one away and then you get a fresh piece and repeat. And then if you need to do the other side, again, a piece of cotton wool, wipe from the inside out, throw away. Or you can use express breast milk. Again, that's a magic substance. If the baby's eyes get really, really puffy, really excessively oozy, then it's likely that you're going to need to see a doctor, okay, just to get some drops. But if you any worries, any concerns, you just call somebody. You will be getting visits when you get home, either by the midwives or the support workers, and we're really, really flexible and we can give you as much input or support as you need. All right. Now, so that was the basic stuff. Now, the other thing, Sarah spoke earlier on about the importance of waking baby at least every 2 to 3 hours for feeding in the early days. Now, our babies, when they're born, it's really, really beneficial to their development because their brain is only 25% developed at birth. We actually deliver our babies really, really early as in the mammalian kingdom, and it's all due to the way that we have evolved. So in becoming upright, our pelvises have become narrower to support our upper body. That freed up our hands and we became creative, and you just look at where we are now, and that's all due to evolution and our dexterity and our brain development. So we've now got a very large brain with a very narrow pelvis. So we deliver our babies very early because we would never physically be able to carry them any longer. Ideally, we would be carrying them for at least another 3 months in order to get them better prepared for life on the outside. But we physically wouldn't be able to carry them that long or safely deliver them. So we deliver them very, very early. So that means at birth, your baby's brain is only 25% developed. And the brain is constantly growing, constantly making new connections. So babies don't really sleep like we do. They actually are operating on a basic survival instinct. In order to survive, your baby really has three fundamental needs. He needs food, he needs security, and he needs warmth. And he gets all of those things when he's at the breast. So often, or if he's being formula fed, when the baby's being held. So when you're holding your baby feels warm, he feels safe, and he's got access to food, so he sleeps. But they only have light, active sleep because the brain is constantly developing, constantly making new connections. So what happens is your baby's asleep, he's safe, he's warm. So we put the baby down on his back and we've straight away taken one of his fundamental needs away. We've taken that security away, and it's very likely that he's going to wake up. So after about 10 minutes, he starts to squirm, he starts to move, he starts to yell. So you pick him back up. You put him, cuddle him in. It's okay, I'm still here. He's safe, he's warm, he goes back to sleep. Now this cycle, this pattern of behaviour is likely to be more prevalent at night, and it's all to do with circadian rhythm. Circadian rhythm is our body clock, and it's how we've evolved. So we follow the sun. So as the sun comes up in the morning, our adrenaline levels rise. And in the day, we're very alert, we're functioning on high levels of adrenaline, we're very aware of our surroundings and our situation. And then at night, as the light levels drop, our eyes register the lowering light. They send a message to the brain, it's getting dark. So we produce a hormone called melatonin, and melatonin reduces our adrenaline. As adrenaline comes down, this is where the magic happens. Oxytocin and prolactin come up, and oxytocin and prolactin are really good mommy hormones. They're the hormones that are really important for breastfeeding, and often the hormones that get mummies into labour. So as oxytocin and prolactin come up, your baby knows this because he's been following that cycle of hormone throughout the whole of his development in the womb. So he's already hardwired to know that nighttime is a good time to be awake. So be prepared that that is normal behaviour. That is what babies do. And you may find actually that your baby is already following that pattern of behaviour. So make a note of when your baby is having his wakeful times. Make a note of them now in pregnancy, because it's likely that he will follow that pattern when he's been born. Okay, so I'm just going to refer back to my notes. So babies don't produce melatonin because obviously their brain hasn't developed that ability. So he's going to be following your cycle of hormones for a little while, and they start to produce their own melatonin when they're about 12 weeks old, and that would tie in with the 4th trimester. So if you think we have the 3 trimesters of pregnancy, and then when your baby's born, that is the 4th one, the 4th trimester. I know you can't have 4 trimesters, but you know what I mean. So there are ways that we can adapt to broken sleep. We can think about white noise. We can think about wearing something that's got your scent on it. The safest place for your baby to sleep, without a doubt, is on their back on a firm, flat surface. And that absolutely, without doubt, is the safest place for your baby, on his own sleep space, always in the same room as you for the first 6 months. Unfortunately, babies don't like being on their back. As we've already discussed, all their positive sensory sites are on their front, and when they're with you and they feel safe and warm, that's when they sleep. So it is a process. Sleep is very much a developmental process, and it's normal for babies to wake throughout the night up to and beyond the age of 2. Okay, so it's going to be a really difficult time because you're still following your circadian rhythms. Unfortunately, babies, you know, have other ideas. But think about ways of coping. Think about, as I said, the white noise, wearing a top that's got your scent on it, and just be prepared to be awake at night. Okay. It's never too early to talk or sing to your baby. A newborn baby's hearing is really, really well developed. And reading to your baby or singing to your baby will be a really powerful tool when your baby's been born, because he will recognize that pattern of sounds, and it will be a source of great comfort to him. Babies love movement and sound. Okay, so think about the shh noise. Babies love the shh noise. Shh. That again is really, really a useful tip. I could talk a lot more, but I won't, because my throat is getting drier and drier. But when you go home, we will come and see you, and we can go through a lot more stuff with you. Going home with your baby can feel really, really scary. Okay, so don't try to achieve too much in the early days. We would encourage you to have pajama days. Okay, be kind to yourself, as Sarah said. Your priority is your baby. Everything else, unfortunately, is going to have to take a bit of a backseat, and we're going to be led by our babies. All right. There will be lots of support for you. There's lots of support. I think at the end of the session, we will be giving you links to really, really useful websites as well, because if you Google stuff, it will come up with a minefield and it will frighten you to death. You've got what0-to18.nhs.uk. There's the Lullaby Trust, which is invaluable for safe sleep. Since they introduced the back to sleep, one of the questions we get asked a lot is, if babies don't like being on their back, why are we putting them on their back for sleep? And it's because since they introduced the Back to Sleep campaign in the 90s, sudden infant death dropped dramatically. Okay, so it really is the safest place for your baby. You've got BASIS, which is Baby Sleep Information Source, another invaluable resource. Yeah, I think that's it. Okay, so I'm going to pass you back to the professionals.
So back to me. Let me just show you the next slide. So yeah, so I'm going to talk a little bit about melting into parenthood, and as we're recording this on the hottest day of the year, we're all a bit melting here as well. So so just come back off of that one so you can see me. There. So be kind to yourself. So I know my colleagues have already mentioned about being kind to yourself, and in the first few days it's a period of recovery, you know, from your delivery of your baby, and it's, you know, you have to run a marathon, so it's really important that you look after yourself and other people look after you. So eat well and have lots and lots of fluids. If you're breastfeeding, then breastfeeding makes you very dehydrated. So always make sure that you've got like a pint glass of water by the side of you. And making time to eat is really, really important, because you know you need the energy to care for this newborn that you've had, and you know, it's important that you know, you look after yourself as well. So lockdown benefits. You know, we as professionals now have seen the benefits. I know we're kind of easing lockdown slightly now, but we've seen the benefit of restricted visiting, giving parents like more time to bond with their babies. or the baby, and rather than having to make time for visitors. It's really important that you bond with your baby, and if you've got visitors coming around, you know, sort of like they don't want to come and see you now, they want to come and see your baby. So, and they tend to sort of outstay their welcome. It's quite stressful. You want to get them cups of tea and everything else. So, so we've found that the lockdown benefits, you know, really have worked well for sort of bonding with parents bonding with their babies. We've also noticed that breastfeeding rates have gone up as well. So just because, you know, sort of babies have literally had that time to concentrate on getting the breastfeeding established. Breastfeeding can be a challenge. And it does take a lot of time. So just make sure that you have lots of time for yourself as a new family. Rest and tag teaming. So we recommend that you take it in turns to catch up on your sleep. So if baby's feeding, then and mum's got baby, then partner, you go off and get your head down for a couple of hours and refresh, and then you can swap over then. So once baby's settled, then you can take over, and then mum, you can get your head down and you can get some sleep as well. Okay, so really important to sort of tag team in the early days. Pelvic floor exercises. Now, as midwives, we do nag you about your pelvic floor every time we see you, but it does help to prevent future prolapses. So, you know, they're very important exercises to do. So it helps to strengthen the pelvic floor, which supports the bowel, the bladder, and the uterus. And your midwife will discuss this with you on every contact. Okay, so and she'll also explain how to do those pelvic floor exercises if you're unsure. Baby blues. So be prepared around about the third day when you're home, or third day anyway, even if you're still with us post birth. It's very normal to feel emotional around about this time. And this emotional feeling will quickly pass, but we go through lots of changes, very like sort of physically and emotionally during this time, and it would be unusual if we didn't struggle at times. So if the feelings of sadness or anxiety, if they persist and they're not going away, then it's time to talk to someone about it. Okay. Very rarely we sometimes see postpartum psychosis, and it's a rare mental health condition, but it starts in the first few weeks following birth, and it can include hallucinations, delusions, and confusion. Okay, so it can be very frightening if this happens, but there is help out there, so it's really important to remember that, and treatment available. Okay, right. So the next couple of slides, we've got a Mother's Day scenario and a Father's Day scenario. So we suggest you take a bit of time to read these scenarios, and then it's really good discussion point with you and your partner. So if I click on but you can obviously sort of do this in your own time. But it's quite interesting read, and it's like I say, it's a really good discussion point.
Right, so that's me again now, the last bit. Basically everything we have said potentially is a little bit scary at times, but what you need to know is that you're not alone and you do have us. It does sound like that many doors are going to close to you of the things that you do now and the life you have now. But what we want to leave you with is that this is an amazing adventure. It's something that you will treasure, that you're growing right now for the rest of your life. It won't be easy, but there are many, many more doors that are going to open to you, and your adventure will continue. It's an exciting time for you, and we're there to help you. So those are the useful links for you, so please have a look at those. I think Karen's given you quite a few also, she's sort of mentioned. So yeah, you're not alone, lots of support. Go and grow and deliver yourselves a lovely baby.